When we talk about gastritis, in summary, there are two categories of patients who suffer from gastritis, or two categories of patients with constant gastritis. The first category is the first category are patients who go to the hospital regularly for gastritis checkup, but they notice that they don't have gastritis, or the test positive for gastritis shows negative, but they keep on experiencing symptoms of gastritis. And another category of patients are patients who um, through test procedures, it shows positive for gastritis, but they keep on taking medications, but then the gastritis doesn't get eradicated from their body. Now, there is another cause of gastritis which is different from the known cause that we know, because majority of individuals think when we talk about gastritis, we are talking about hunger. When we talk about gastritis, we are talking about starvation. Now, one cause of gastritis which many people don't talk about is NSAIDs or painkillers. So we'll talk about NSAIDs, we're talking about non-steroidal anti-inflammatory drugs, or in summary, painkillers. We're talking about painkillers, we're talking about ibuprofen to be precise, especially ibuprofen. That's one drug that many people need to take note of and be careful with. Now, when you consume painkillers so much, it can expose you or it can lead to gastritis. Now, here's the procedure. Excuse me. Now, what you have to understand to begin with is that the body produces acid. Now, the function of that acid is to make sure that food that gets into your system is being disinfected. Disinfected in the sense that that acid destroys bacteria. And also, the same body produces mucus, because excess of that acid is going to burn down the walls of the stomach, which is going to lead to gastritis. Now, the same body produces mucus that will counteract the effect of that acid, so that it doesn't lead to gastritis. Now, what those excessive painkillers or excessive consumption of painkillers does to the body is that the cells which produces the mucus, those painkillers goes ahead and destroys them. So once those cells have been destroyed, no mucus is being produced. So the strength of the acid won't be reduced at the level of the stomach, which is going to lead to severe gastritis. So excessive consumption of painkillers is one of the main reasons why people suffer from gastritis. Now, you may go to the hospital and the test procedure for gastritis shows negative, but you may still be experiencing the symptoms of gastritis. Reason being that the root cause of what you are suffering from is not literally the bacteria, it's just excessive consumption of painkillers. That is why when you're examining yourself for gastritis and some of the causes, if you rule out hunger, make sure you check out for your consumption rate of painkillers. If it is too high, make sure you reduce it, because irrespective of the amount of treatment that you take, it will still be impotent to that same condition. So make sure you avoid excessive consumption of painkillers, especially over-the-counter drugs. And don't forget, applied knowledge brings power. Thank you.